Good afternoon. Here we're going to do a hip and kind of an IT band protocol using the RRT. First we'll start at the hip. Keep in mind that one of the contraindications for rapid release therapy treatment is new metal hardware that's been installed in the last 3 months. So if this was a total hip protocol, we would assume that at least 3 months had passed. We're going to start up here in the proximal glute muscles. We're going to cover the glutes maximus, medius, cover the piriformis, using our small, slow, circular strokes, or perpendicular parallel strokes are fine too, at about 1 inch per second. We're going to cover the posterior hip capsule, the hamstring attachments. Going to work our way distally as we come across and get into the IT band. We also want to make sure that we encompass the rectus femoris attachment and the other hip flexors. As the protocol progresses treatment by treatment, we may also get into some of the hip adductor muscles to release some of that. We're just going to work our way distally. Because of the length of the IT band and the soft tissue that encompasses the hip, this is probably one of the longer protocols at about 4 to 5 minutes. As you'll see in the protocol booklet, you never exceed 5 minutes of treatment at any given time. But everything is proportional to mass, so if we encompass the hip and the entire lateral thigh, that's one of the larger areas that we'll cover. So that does usually take about all 4 to 5 minutes of our time. We'll go all the way distal on the IT band, covering both the anterior and posterior portions. Circle back around. Again, once you know the patient has reacted positively to the first treatment, you can add a little bit of length of time and you can encompass the hamstrings. You can spend a little bit more time in the hip flexor and the hip adductor muscles. And that encompasses and concludes our abbreviated treatment of the hip and IT band.
Rapid release therapy is intended for relaxing muscles, increasing circulation, and relieving aches and pain.